My name is Dr. Paul Finger. Many of you know me as an ocular tumor specialist with a particular interest and expertise in ophthalmic radiation therapy. This is why I started a company called Liberty Vision. Liberty Vision makes a unique beta source for episcleral treatment of ocular tumors and benign diseases. It's well established both in research studies, clinical studies, and practice that brachytherapy, which is a form of radiation, can be a useful adjunct in the treatment and reduction of scarification and neovascularization. To date, however, there has been limited use of these treatments despite their clear benefit and track record, both improving outcomes and enhancing the persistence of therapeutic effect. Let's examine why this is and how a new brachytherapy delivery approach created by Liberty Vision can unlock the treatment's great promise. For many years, there was a strontium-90 applicator that could be placed approximating the limbus to decrease the incidence of recurrent pterygium. As you can see in this slide on the left, this was a stainless steel casing which held the radioactive source. It was shielded by plexiglass as it was placed on the eye. There was no view of the source as it was covered by stainless steel. In addition, the strontium-90 applicator is no longer manufactured or supported. It's bulky and clumsy, making it awkward and fatiguing to use, and it cannot be autoclaved or properly sterilized. Most centers have decommissioned their strontium-90 applicators not because they didn't work, but because they could not be handled or stored or supported. Many of you know me due to my research work on ophthalmic plaque brachytherapy. This is the kind of brachytherapy that's used on the posterior segment of the eye. It has been used for the treatment of choroidal melanoma and various other benign and malignant tumors. Once the plaque is sewn into place, it cannot be seen. It's typically obscured as it sits on the back of the eye. The only way to make sure that the plaque is in position is to do ultrasound, which is an indirect measure of plaque placement. In general, it takes a fair amount of skill because eye plaques are difficult to position and suture in place. They require multi-day treatments as well as surgical removal. I've long thought that there has to be a better way to deliver radiation to the posterior segment of the eye. So what would be these new attributes for a new optimal brachytherapy treatment? Well, we should benefit from it being extraocular and therefore minimally invasive. However, we need a way to increase the accuracy of placement guidance and a way to document assured source positioning. Matching the radiation distribution to the target volume is also important, as well as minimizing side scatter to healthy tissues. What we want is a single, relatively quick treatment. So let me introduce you to solutions provided by Liberty Vision. On this next slide, you'll see two different handheld applicators. One is titled the iWand A for anterior, and the other the iWand P for posterior use. Each has unique and very helpful characteristics. Inside of each are a radioactive disc. The disc is made of titanium, and it allows for high dose rates of irradiation because it is a beta applicator. Each source is incorporated into the handheld applicator just prior to treatment. Each applicator is made of advanced, transparent polymer material, but they're quite different. The iWand A permits direct visualization of the source as it's placed on the eye. Remember, this handheld applicator was created to allow the surgeon to place the source directly on the anterior surface of the eye where it's needed. In contrast, the iWand P was designed for the back of the eye where direct visualization isn't possible. Therefore, we have a patented light guidance feature that can be seen through the pupil during treatment. Both the iWand A and the iWand P were designed to be lightweight for a fast, comfortable application. Let's take a closer look at the iWand A. Here we have a handle, which is ergonomic. We have a clear aperture through which you can see the radioactive source, and it is covered by a clear backing which shields both the surgeon and the patient. On the next slide, you can see the device placed on the eye as to straddle the corneal sclerolimbus. Next, we superimposed isodose radiation contours to give you a general feel about the distribution of radiation as it enters the eye. Notice there is very little side scatter. This limits the exposure to collateral tissues. Now let's take a look into the posterior segment. As we go through the pupil, we can see the macula with 4 lights surrounding the fovea. As you can see, the lights surround the target much like lights allow pilots to fly at night and land on the runway. Having guiding and defining lights allows for photo documentation of radiation source placement. Clearly, iWand P simplifies placement accuracy and confidence by surrounding the radiation source with guiding and localizing lights. Here is a cross-section that shows the lights shining through the sclera, as well as the radiation dose distribution, in this case, beneath the macula. Liberty Vision has provided a brief movie to demonstrate posterior application of the iWand.
This is an extraocular procedure. The eye is not invaded, which all but eliminates the chance of infection, retinal detachment, and vitrectomy-associated cataract. Our disc-shaped source makes it nearly impossible to miss the target. The only normal tissue to receive higher than a prescription dose is the radiation-resistant outer wall of the eye, the sclera. The least possible dose goes to the raised and thus protectively displaced retina. Our source has been configured to minimize any lateral radiation to the optic nerve. Our source produces a dosage pattern that conforms well with the treatment volume. The radionuclide we have chosen has a rapid drop-off of intensity, limiting the spread of radiation. Finally, we have perimeter guiding lights flanking our source, which visibly glow through the back wall of the eye when viewed through the pupil during the 5-minute exposure. These lights show where the radiation source is positioned, much like rows of lights help pilots know where a runway is at night. Together, these design features augment the delivery of radiation treatment that is accurate, controlled, and conformal.
The next 2 slides are a little bit physics heavy. First, we have a 2-dimensional slice through the center of the source, which shows how the dose attenuates quickly as it enters the eye. Also notice how fast the radiation is attenuated at the edges. The next slide shows how fast our source decays. It has a 64-hour half-life. Therefore, within a month, it has almost completely decayed, allowing for proper disposal. This presentation clearly shows the benefits offered by both iWand A and iWand P. These benefits provide relatively low-cost, minimally invasive treatment in a single session. We expect this will make patients and doctors happy. So in conclusion, studies support radiation's ability to close abnormal blood vessels and prevent scarification. For example, pterygium or the cutaneous keloid, which are commonly treated with radiation. Our source has been selected, carefully created, and cleared by the FDA for treatment of ocular tumors and benign growths. For those of you who don't know what FDA clearance is, it means that the FDA considered our device to be relatively equivalent to prior or predicate devices. Liberty Vision agrees with that, but feels it's even safer than prior devices and has been coupled with unusual and extremely helpful handheld delivery systems. So where do we go from here? Now that the FDA has cleared us to sell these sources, and we have defined the CPT codes required for the hospital or ASC, as well as the doctors and physicists, we are working with multiple major facilities to prepare for implementation. Patient safety software monitoring has been completed. We have employed a commercial IRB to monitor for patient safety and to cooperate with local IRBs and ethics committees as needed. We expect doctors to publish their therapeutic efficacy data as time goes by. As you can see, Liberty Vision has created an improved, more accurate approach to delivering localized radiation therapy to treat ocular tumors and benign growths both in and around the eye. Thank you for your attention. Please feel free to visit our website, libertyvision.com, or to contact us if any questions arise. Thank you.